on this patient. Okay, fine. I can take that. I can take hydrocephalus. I can do it. It's almost here. It's here. So let's see. There is a axial FLAIR, a axial T1. There is severe hydrocephalus, severe white matter disease, a bunch of small lacunar brain infarctions right there, right there. That's quite common at his age. Mesial temporal regions are quite preserved. Let's see a diffusion weighted sequence. Diffusion weighted sequence is fine. T2 should look awful. There is lacunar infarction right here. Some lacunar infarctions all over the brain and the brainstem and the cerebellum. This patient is almost 100, a century, 100 years old. So what did you expect? That is diffuse arteriosclerosis of the intracranial arterial vessels. Of course, it couldn't be different than that. It couldn't be the opposite, because this patient is almost 1 century old. It's just twisted to the right, to the left. I can say this is a MTA3 hippocampus. Is of course hippocampal atrophy as much as the rest of the brain parenchyma. They did a contrast enhancement phase. We're going to scroll over the MPR. Why not? Axial MPR here. Let's see if something odd enhances. No enhancement on the sagittal view. Let's grab a much better view, which is the axial view. Real men only need axial sequences. Sagittal, coronal, and MPR are for children. So I'm no children. I'm old. My hair is gray. And I'm quite tired. But still, axial view is more than enough. Let's see coronal view, because why not? It's here. Let's see if we have any anomalous enhancement. No anomalous enhancement. No whatsoever. So this is just an old man's brain. Old man's brain. Lacunar infarctions, infarctions, ischemic spots, old ischemic spots all over the brain. Severe hydrocephalus, severe microvascular white matter disease, severe atrophy of the brain in the hippocampus, MTA3 and Fazekas 3 as well. And we are just summarizing it. And we are going to be done arteriosclerosis of the intracranial arterial vessels. Of course, why not? Just finishing it up. And we are done.